Hi, my name is Christy Bishop, and I'm the Medical Office Director at the Skyline Clinic for Kaiser Permanente, Colorado. Like so many of us, I'm working from home, but I really wanted to have this message to you today. A member of your care team will be out shortly, but I wanted to introduce a concept that I have a lot of passion around. If you haven't heard of the concept of the patient-centered medical home, I hope this resonates with you because it encapsulates all of the values of Kaiser Permanente. The concept started in 1967 by the American Academy of Pediatrics when the term medical home was introduced. This was according to a publication from the American Academy of Family Practitioners in November of 2007 called The Patient-Centered Medical Home. In the early 2000s, the 7 tenets of the patient-centered medical home were documented and are now known to be the principles of the PCMH. And these are having a personal physician, physician-directed medical practice, whole person orientation, coordinated and/or integrated care, quality outcomes, access to care, and payment transparency. It was disruptive and transformational for all stakeholders in healthcare, including patients, providers, and even payers. Some of the early benefits are still with us today. The most important is that you have a trusted, dedicated primary care physician. And my personal favorite is that we realize that you are a person and not just a patient. This means that you are more than who you are in the exam room. You have families, maybe a career, hobbies, dreams, and fears. You are not just your disease state or your afflictions. For this reason, we want you to be comfortable to include family members in your visits. Additionally, recently, with the advancements of the patient-centered medical home, we include services to wrap around you as a person. These include social workers, pharmacists, behavioral health professionals, and others as your health journey continues. Now let's get to some of the perceptions of the patient-centered medical home. For patients, one of the big frustrations were the so-called gatekeepers. In the 1990s and 2000s, patients felt that primary care clerks were standing in the way for specialty visits, particularly in orthopedics. According to the U.S. Department of Health and Human Services in an article in 2001, the PCMH model actually allows for collaborative decision-making, including self-care and understanding all options, which allowed for less invasive interventions as well as cost savings for you, the patient. And if you ultimately elect to see a specialist, 90% of these departments are self-referred at Kaiser Permanente, Colorado. When we asked for feedback, we heard that some of the frustration wasn't with the care providers. For instance, we realized that if you come to the lab or medical imaging, you want the same attention that you get from your doctor. For this reason, we have adjusted protocols based on your ideas. You will be able to track your lab and procedure results, and through the MyChart functionality, you will not only see your results, but applicable comments from your care team. We realize that health is a team sport. With that, please continue to voice your suggestions, your comments, and concerns to me directly at christy.m.bishop@kp.org. Thank you for your time.